and in this case you and your baby. So this week sees us kicking off World Breastfeeding Week, and breastfeeding across the world varies quite dramatically actually. Now some of that's need, some of that's pressure, all sorts of reasons for that. But what you'll find at Growing Smiles is all the women who are related to this business have breastfed their babies, some for longer than others, and we all had experience of the challenges, because unless you have a bit of support and encouragement, particularly in those first few days, it is so easy to give up. And I have known people who have actually been actively discouraged from breastfeeding by medical professionals, and they've stuck with it and they've done a really brilliant job. So, as I say, if you haven't been here before, you're welcome. I tend to turn up here on a Thursday evening and talk about something related to teeth. It can be totally random. It can be something that's been raised with me during the week by somebody. It can be a topic related to something globally like this. But ultimately, we're here to help. So if you've got a question, if you've got a query, please ask us. If you don't want to put it in the comments, you don't want to put it public, that's absolutely fine. Drop us an email at info@growing-smiles or direct messages. And bear with us, because sometimes we don't always pick it up instantaneously, because there are only a finite number of people around here. And if it's a technical, a health, a professional dental related question, it'll tend to have to wait until one of us who are suitably qualified can pick that up. So anyway, like the page, follow us on whatever your social media platform is, but ultimately, as I say, we're actually here to help. And one of our team, Heather, actually is a breastfeeding support worker, so we've got a lot of experience with breastfeeding, and we are big supporters of it. And it is one of those things that you say, yeah, okay, World Breastfeeding Week is a global campaign, and it's celebrated in the same week, the 1st to the 7th of August every year, and it's there to promote the importance of the benefits of breastfeeding to both newborns and to the mothers. And then you can go, right, what's that got to do with teeth? What's that got to do with oral health? Well, hopefully I will enlighten you a little bit. And excuse me, I have got dreadful hay fever. My nose is streaming, my eyes are streaming, and I'm absolutely melted underneath the light here. So bear with us. Well, what do the experts say? That first week is critically important, and if you don't get suitable support during that those early days, no matter what your intentions are, you are much more likely to give up. So if you are planning on breastfeeding, we'd always encourage everybody to give it a go. And sometimes it's not possible, and that is also okay. Don't beat yourself up about it. But if you can, try breastfeeding, and let the people around you, your partner, your medical healthcare team, know that you want to try breastfeeding. Because that's really important, because you want to have those key people who are going to be with you in those first hours and first days, who are going to encourage you. And I think it's so easy in those early days that everybody gives you their penny's worth. They will all tell you what you should be doing, when you should be doing it, how you should be doing it. And ultimately, you and your partner have just come home with this bundle, and you're going, I don't know what I'm doing. And you know something, we've all been there, and we've all gone, wow, we've made this human, but I'm not really quite sure what I'm meant to do with it. And breastfeeding is one of those things that if baby latches on instantaneously, you are absolutely fine. But that doesn't always happen, and you might need a little bit of guidance and advice and a bit of encouragement and moral support to get baby latch on and actually do the thing properly, so that they are actually getting adequate nutrition, because it is the best nutrition, and it's best both for mums and for babies. And while this whole sort of global campaign thing is all about sort of promoting breastfeeding across the world, which in some cultures it will be very different, in some places it will be the only form of feeding, so it means different things in different places. But there is no doubt there are breastfeeding inequalities, and what they're trying to do is target audiences, to support society, organisations, government, individuals, policymakers, health systems, workplaces, communities, to encourage breastfeeding and make it acceptable and normal for all. We've all seen situations when a mum has gone out for coffee and she's breastfeeding and somebody complains. We don't want that. I mean, it's a totally natural thing to do. It's been happening forever. So, you know, we want to make it accessible to all. So that's a little bit about breastfeeding and the whole Breastfeeding Week campaign. And there's loads of stuff, and I'll stick a couple of links up afterwards. You can have a wee look at that. But what's that got to do with us and growing smiles and oral health? Well, no one ever wants their children to suffer. And as I have said so often, what my experience has with children and children with dental problems and oral health problems, the whole of my professional clinical life, and there is nothing more heartbreaking than a parent bringing a child in who has got disease, who's got tooth decay, who's got cavities, and the parents thought they were doing all the right things and they were ticking all the right boxes, and still their child ended up with problems, and they're devastated. And you know, it's difficult because sometimes the first time the child gets in a dental chair is when there's a problem, and that's not an ideal scenario for your first dental visit, believe me. And then you then take that first dental visit being a negative experience into adulthood. Those adults, those older people who have real fear and anxiety about dental visits, you talk to them, they will nearly always end up telling the story of something that happened to them as a child. So none of us want our children to suffer. None of us want to see our children have diseases that are preventable, and I think that's the key. By and large, in the 99% of the cases, tooth decay and gum disease, basic, most common oral health problems are preventable. And often we don't know what we don't know, and we're not very good at sharing as to how you prevent it. And then you think about, you know, how many dental professionals' kids actually have problems. You know, you start to say, well, they must be doing something right. Why? Because they know and they have the means to actually put their knowledge into practice. So, you know, it's all about making good, healthy choices for our families, for our children. And that includes, you know, it's not just about breastfeeding, it's also about healthy diets, proper dental care. But, you know, breastfeeding is, you know, on the most part, the most amazing bonding experience for mother and baby, and it's got benefits for both. So we really should be encouraging you to try breastfeeding. And as I say, if you can't, don't worry about it. You know, there are good options, but still, it's only one factor in the way you create this healthy human. Who is a healthy baby, who's a healthy toddler, healthy child, who becomes a healthy adult. So, you know, being a parent is so many things, and it is the hardest job you will ever have, but you know something, it is the best job you will ever have. And I say that all the time to new parents, and I mean, we still think, Jeff and I still think it's the best thing we ever did was, you know, create two humans who then have gone on to create other humans. So it's really quite amazing being a parent, but it's also an incredibly stressful time. And I think one of the nicest things about breastfeeding is it's that period that you literally can just be settled. You can't really walk around, you can't do anything else. You know, you just are concentrating on the task in hand. And I think if we all took our lives a little bit more like that, you know, we concentrated on the task in hand instead of our brains flying all over the place, you know, we'd maybe be a lot better off. So, you know, the WHO and UNICEF recommended that children really should initiate breastfeeding within the first hour from when they're born, and then be exclusively, and I mean that's the only food, for the first 6 months of their life. Okay, now that's maybe not practical for some parents, but you know what you can do, you don't actually always have to have baby breast. The methods of expressing breast milk these days are so much more superior to what they were in my day. It does make it much more accessible for parents, for mums to breastfeed for that first 6 months of life and give baby the best start. So since 2001, World Health Organization has recommended that mothers everywhere in the world exclusively breastfeed their infants for the first 6 months for optimal growth, for optimal development and optimal health. After that, what you want to be doing is giving them nutritious complementary foods as you actually then sort of have breastfeeding continuing for, as WHO says, 2 years and beyond. Now, the thing about that, and I'm going to come back to that in a minute, is that the World Health Organization makes global strategy. They make global recommendations, but there's always local population variations within that. So in some countries in the world, breast milk will be the only option for quite some time. In other places, you have lots of choices, and some parents will stop breastfeeding at 6 weeks, 6 months, a year, 18 months, 2 years. But there's no doubt it really does give them the best start. So that, Scientific Advisory Committee on Nutrition, they published feeding in the first year in 2018, and that policy advice in regard to breastfeeding has not really changed, so it is. And in regard to oral health, what SAN, so the Scientific Advisory Committee on Nutrition, what they concluded was that breastfeeding up to 12 months of age is associated with a decreased risk of tooth decay. And that is something I really want to emphasise. So if you can breastfeed for the first year of your baby's life, we know it is associated with a decreased risk of tooth decay. Now, that doesn't mean that you can't go on and breastfeed longer, shorter. There's lots more other variables come in once you get past that 6 months mark, and I think that's where some of the evidence is a bit woolly around some of this as to how long you continue to breastfeed. But something, it's really important that you actually, think of this not just as your teeth, but this is a whole human, and we know that it's associated with, reduced risk of infections, less things like gastroenteritis, respiratory infections, middle ear infections. So there's lots of sort of benefits from trying to breastfeed exclusively for that first 6 months. In the UK, let's just get to that local population. Breastfeeding is actually very poorly supported. There's only about 34% of mums still breastfeeding their child at 6 months, and only 1%, that's a tiny amount, of all the new babies born and all the mums who are exclusively breastfeeding. Usually something else has been brought in, and I have talked before about the pouches and baby supplementary foods that are actually being targeted at babies from 4 months. The only nutrition you need is breast milk for that first 6 months, or infant formula if you're not actually breastfeeding. So it's the norm. That is what our physiology made us for, and it is really a good start for your baby's life. So let's talk a little bit more, if this is going to move on, it may or may not. What I want to emphasise is one of the things that I often get tipped back at me about, and I'm just going to read here this evening, is baby teeth really matter. We tend to sort of think, sorry, you're not like a second lot, does it really matter? And the number of times, and I hate to criticise grandparents being one, but the number of times parents will say to me, the grandparents give them sweets all the time, and and grandparents will say to me, sure, it's only their baby teeth. Your baby teeth are there, the same as your adult teeth. They help us eat, they help us speak, they help us smile. They are really, really important for our own health and well-being, our mental health, our physical health. And yet, the most common reason for children being hospitalised between 7 and 9 years old is, actually that age group, not quite that, young children being hospitalised is for tooth extraction. And if you haven't seen it, go and look at the BBC Parental programme about tooth extraction. It was 2 or 3 weeks ago, it was on Monday night, and Professor Helen Rod was on, and it was really interesting just to see the impact, and for something that is totally preventable. So as I say, breastfeeding gives you the best start with that. And as I say, it's what's best for you, what's best for your baby, and what's going to work in your family. But, breast milk has extra bonuses. It's got the right sort of types of healthy bacteria. It's got lactobacilli in it. It's got human casein. Now, casein is interesting. It's got immunoglobulins, which are always really good for healthy mouths as well as healthy bodies. But casein is really interesting because when I speak to parents who have found their children have early signs of tooth decay or early signs of tooth wear or maybe more than signs of hypermineralization, one of the things that I recommend we use is a product called tooth mousse. Now, the thing about tooth mousse is based in the milk protein, casein. What did I just say? Human casein is in breast milk. So it sets you up for a healthy environment in the mouth. Our biggest risk in the mouth are bacteria called Streptococcus mutans. And strep mutans are basically the babies. And what you want to do is to try and create an environment in the mouth that is healthy even before the teeth come through. And breast milk helps that. So, once you get past 12 months, as I say, the whole thing about slowly breastfeeding on demand, breastfeeding nocturnal, on demand at night, the scientific evidence all gets a little bit grey there. Often because the other things that are going on in relation to that baby's oral health are not taken into account. So, it's not that they're solely being breastfed anymore. They're getting other food. Are they having their teeth brushed? What are they having their teeth brushed with? Are they using fluoride toothpaste? All those little things, what other things are being eating, what other things are being drunk. Is there snacks? Are they healthy snacks? Have they got sugar in them? I'm going to talk a little bit about free sugars later because I think there's no time like the present. I will always highlight that just because something says no added sugar, it is not sugar free. So I say there are risks there, and I say over the years the thoughts have changed on this, and I say the problem is evidence to support this because it used to be on demand nighttime breastfeeding where a baby was latching on and off and milk was pulling because there's lactose in it could potentially cause tooth decay. If you leave anything lying around long enough or doing something like that, it may well cause a problem. I always say you need to look at your risk, you need to look at the other variables, and you need to see are there signs of change, because you will see them. And I'm going to show you how you lift your little one's lip and look for signs of demineralization, because that's your best key. Because if you see it, something's going on, something's not working, and if the only thing is that you're on demand nighttime breastfeeding the babies on and off all night long, and that's the only thing that is that sort of risk factor, that's when you maybe will need to think about it twice. But if there's other things going on that are more likely to be causing tooth decay, well then, exclude those first. So as I say, it's what's right for you, it's what's best for your baby and your family. I'm not, those are your root. But I say, though, that frequent, prolonged, nocturnal breastfeeding and tooth decay is a bit of a moot point. And it's one of those things that I always say, if it's working for you and you haven't got any signs of tooth decay, there's no sign of demineralization, you're doing all the other things, the toothbrushing, no sugar snacks, all that stuff, well then, it's a risk. And Heather, our web designer, breastfed for, gosh, I need to check exactly how long, but definitely over 2 years, and perfect teeth, beautiful smile. So as I say, but I know she was doing the other thing. She was doing the toothbrushing, she was controlling the frequency and the amount of sugar intake. So as I say, it is got to be something that you need to talk to your dental team about. And I think that also should reflect on dental teams being prepared to talk about it. Because I know some of my professional colleagues, oh no, they shouldn't be doing that, shouldn't be, but you can't say you shouldn't be doing something if you don't know what your cause is. So the first thing I always want to know is why is there demineralization? What could be contributing to it? What could those contributing factors be? And then you start to exclude things and see if you can work it through. And that's one of the reasons why it's so important for your baby's first dental visit to be by their first birthday. And you may go, what? First birthday, baby in a dental chair. No, they don't really sit in the dental. Some do, mind you. I think I actually had one of mine in a dental chair at 3 months, but that was partly because that was where I was. But you know, it gets them into the habit of going. They also give you an opportunity to ask questions, to get clarifications, to have those concerns that you might have answered by a professional. Now, that also depends on the professional's knowledge, experience, and interest in, you know, paediatric dentistry and all those sorts of things. And sometimes your dental team may well just say, listen, will you go and speak to a lady on this matter because she knows what she's talking about. So as I say, you know, it's, if you're not sure, please ask. But what we do want to do is try and encourage you to breastfeed for those first 12 months, because we know it helps to reduce the risk of early tooth decay. And as I say, it also then depends on these other things, that sort of free sugar thing. So breastfeeding in itself does not cause tooth decay, does not cause cavities. That sort of defunks the whole thing about cavemen and every generation that came hundreds of years before us. You know, they didn't have tooth decay. So, you know, and they didn't give their babies milk from any other sources except human milk. So, you know, formula didn't come into it. So, you know, it is related to a modern Western diet, and where we do eat very consistently, eat and drink high amounts of sugar. And I mean, I've got lots of variations on this sort of stuff on the website. So if you go into the website and you go to the advice page, there's a drop down menu and it will give you the life cycle of your smile. That will drop down and you will see basically age bands on it. So it's a continuing process of getting that all up to date. But pregnancy, being a parent and baby in those early years are all lots of information there that you may well find. And as I say, if there's something that you don't know what on earth they're talking about, please ask us, because again, we're here to help you. Your first smile, really special time for parents, and that first tooth arrival is like, woohoo, first tooth fanfare type thing. Sometimes babies are irritable and dribbly, sometimes quiet and smiley. Some parents say that they stop breastfeeding as soon as the first tooth comes through, which a tooth erupting shouldn't be putting you off breastfeeding, because the way a baby latches on, the tongue actually covers those lower teeth. You might get the odd nip, but it shouldn't be a big problem. So, you know, it's perfectly all right to continue on, because during that 6 to 12 month period, you are going to get those baby teeth erupting, both the top and the bottom. The first baby teeth erupt usually the lower front ones, and then gradually the other ones come in. Now, you will not get all your baby teeth until your little one is maybe 2.5, 3 years. And don't get worried if there's no sign of a tooth at 6 months. That is not unusual. You know, some babies are later. If you've got a premature baby, it will be later. You know, other babies actually have been known to be born with the tooth erupted in their mouth. So we are all different. It makes us all very interesting, and babies are no different. But once the first sign of a tooth appears, you need to be starting to clean that. And I'm going to talk a little bit more about it. A dry toothbrush, a smear of toothpaste with at least 1,000 parts per million of fluoride in it. And you need to brush every part and along the gum line of every tooth. And with a little one, that isn't always easy. So, you know, I've got lots of hints and tips of that on the website, also on our social media channels as well. But the interesting thing about this, if you're breastfeeding, that's fine, you continue breastfeeding, but you're also around 6 months when these teeth are erupting, you're starting to introduce other things to the diet. And, you know, babies aren't born with a sweet tooth per se. Yes, breast milk is slightly sweet, but, you know, you don't want to add sugar to food or to drink. And certainly if you've got a baby that's got a dummy, please don't dip it in jam or any other honey, any other sugary substances. And as I say, the whole thing with free sugars is a total minefield. So always you're going to be better with working what is basically homemade. But even that can be a grey area, because the likes of honey is a free sugar, yet honey has many other benefits. So it's not that you don't have it, you just have it at certain times. And certainly fizzy drinks, juices and things, just don't waste your money on them. All you're doing is actually going to stock up problems for your little one with early childhood caries, early childhood tooth decay. Particularly, you know, if they're having that in a bottle and they're literally sucking it all day, you're going to have rampant decay in a very short space of time. And I remember one of the early interviews during COVID on the TV, they were talking about how young mums were coping with newborns, you know, and what was incredibly challenging times in early COVID, and a baby in a buggy with a bottle full of juice, and I'm sort of sitting getting really twisted at the TV and wishing I could speak to that mum and say, you know, you're really not helping your little one, because often these things are done through love. They're not given with the intent to harm or hurt. They're given because people don't know and they think this is being kind to their little ones. So we have a blog post about teething and what our recommendations of, you know, first products for baby's teeth and stuff. That's all on the website. It's easy enough to sort of navigate, and if you can't find it, ask me. You know, you can search for it. What you can do in preparation while you're breastfeeding is get into the habit of wiping your baby's mouth after feed. Now, there's a couple of benefits to that. You're getting rid of, you know, a lot of any sort of debris that's still lying, a lot of bits of milk that are lying about, but it also gets your little one used to you working in their mouth. Now, these are two of our little ones who have come through the Growing Smiles Academy, as I say, and you know, you literally put in your finger and you wipe it round. Now, these are xylitol wipes. Now, these are impregnated with xylitol. And what do we know about xylitol? Xylitol and tooth decay are great because xylitol reduces the number of those bacteria called strep mutant, Streptococcus mutans. Those are the decay causing bacteria. So it reduces the number and it stops those bacteria sticking to the teeth. So while teeth are underneath the gum, can't come to any harm. But once the teeth come through, then they're at risk. And it only needs to be the slightest hint of it, but that bit that's through can be at risk. And I've had parents come to me saying their baby teeth came through like that, and what's happened is it's just literally decayed so rapidly. So getting into the habit of wiping around the mouth, and you might find it, put baby underneath your arm and do it. You might find it like Heather and Rachel did on the mat, and then do it that way. And as soon as the tooth comes through, then what you want to do is actually start cleaning your teeth. Now, tip of the day, week, month, year has been, you know, if you've got any sort of wipes or even a cloth, keep it in the fridge where it's cool. Girls always say to me, tell anybody that's getting the teething wipes or the xylitol wipes, dental wipes, keep them in the fridge, because using them cold is really good for when babies are teething. So there's your mum's tip, so to speak. I didn't even have that option when my lot were small. But as soon as the first tooth comes through, you want to a tiny smear grain of rice amount of family toothpaste on it. It wants to have at least 1,000 parts per million. But you know, some if you're all using, you know, your average Colgate, Oral-B, McLean, whatever, you know, just check that it's got at least 1,000 parts per million and only use a grain of rice. So it is literally a smear. It only takes a smear. Use it on a dry brush because it's way easier to manage, and you don't really need the water. All the water does is ignite the foaming agent, and you get lots of foam, which babies don't always take to, and you can't actually see what you're doing. So dry toothbrush with that. Excuse me, my nose are running. So what you want to do is get into the habit of brushing last thing at night before bedtime and one other time every day. And again, this last thing at night before bedtime, well, if you have a baby that doesn't sleep, that can be a bit hit and miss. But it should be really the last thing that you do before baby goes down. And I have been asked about what do you do if baby falls asleep at the breast. Do you wake them and then brush their teeth? And you brush their teeth as close as you can to bedtime. That's by always. You don't want to wake a little one afterwards. And then as they get older, what you'll do is you'll go from a smear up to the age of 3, and then to a pea-sized blob of toothpaste. Don't like mint? We've got you covered there. We've got lots of mint-free options on the Growing Smiles website. When they get older and they're able to spit out, You want them to spit out but not rinse all the toothpaste away with water. You just want them to spit, leave the toothpaste that way. The last thing that touches their teeth before they go to sleep at night is the fluoride toothpaste. Why is nighttime so important? Well, nighttime's so important because when we go to sleep, our saliva dries up. And when our saliva dries up, we've lost our secret helper. And babies are no different to the rest of it. Saliva buffers and neutralizes acids to help the self-cleansing mechanism. So, you know, it's all really important to have a good saliva flow. And anybody that's taken will know how much saliva can get everywhere. But good saliva flow, I always say, don't knock having a lot of saliva going on, because it is your secret helper and it works away in your mouth. Then I say, once you get to 6 months, you're going to get teeth coming through, and then you've got to stop and think, what else is going on in there? What other foods are you adding into the mix? So you never want to add sugar to either food or drink. The only safe drinks for baby and for small children are breast milk or formula, plain milk when they get old enough, and water. That is it. And if you have a little one that comes up drinking water and they're happy drinking water, I always say you're halfway there to having a healthy smile for life. Where I find it really difficult, difficult for families, is where children have got used to having juice or fizzy drinks. Trying to wean them off that is really, really difficult. So, you know, if you've got a water drinker, I always think you're halfway there. But breastfeeding is going to give you that best foundation to start with. So once teeth begin to appear, then you're going to want to clean them, because you've got the dilemma of when do you brush them, or, you know, all this sort of stuff. How you brush. Now you can see I'm brushing one of the girls' teeth there from behind. Mum has brushed one on the floor. Some people get them tucked underneath their arm. There's many different ways to go about it. They are not always happy about it. But as I always say, just because they don't like having their hair washed doesn't mean you don't do it. It is a very short period of time, and yet it has so many benefits. Now look at that one, same one, slightly older, much happier. So I say, there's ways and means. Distraction works really well, whether it be these days phone screen of some form, singing to them, you know, have a counter, whatever works for you, and make sure it's done last thing at night, as close to bedtime, close to sleeping time as feasible, and one other time every day. Electric toothbrushes from about 3, although there's baby sonic toothbrushes, which is what I'm using over here at the minute. Those are great wee things. Again, like any adult electric toothbrush, the technique is different. So with manual toothbrush, you've got to make the bristles work and do the cleaning. Electric toothbrush, you just set it in place and let the vibrations do that movement for you. So as I say, there's ways and means to do these things. You see. So around 6 months, you're starting to think of weaning, and we always talk about sugar-free weaning, which sounds a bit random, particularly the way so much marketing says it's sugar-free or no added sugar. And this is where there is a total minefield. First of all, once you're introducing them to drink out of a cup, and you can do this with breast milk or with water, an open free flow, basically a free flow cup. So when you turn it upside down, the water needs to flow out of it. What you're trying to do is develop a healthy musculature, so the muscle shape of the teeth and all the rest of it, and actually having a free flow cup does that. Something that they can hold and actually see. So the doily cup there, this one here is what Sure Start off would usually recommend. And they can hold the handles and they can see the liquid in there to control it. It will be messy, but what's not messy about a small child? The other thing I want to mention at this junction also is medicines, because you know, not 6 months, breast milk, purely breast milk, continue on with that breast milk, but after 6 months you're starting to have other things to deal with. Now, your baby might have been on medication from birth, but it may not have been a concern until those teeth are up in and around 6 months. Now, if you're using a very sugary medicine, you're going to increase the chances of tooth decay for the same reason that you're getting that sugar in contact with the teeth, and often it's given before bedtime. So, you know, you give the medicine, then you brush the teeth, and ideally you want a sugar-free medicine. And most doctors now will automatically go for the sugar-free option, but you know, if you look at the bottle and you see there's sugar in it, ask for sugar. Is there a sugar-free alternative? Really, really important, particularly if your child is on long-term medication that maybe has to be given 3 or 4 times in the day, because those are 3 or 4 sugar hits every single day. So I say, you know, not sure, ask us please. But a free flow cup, water, it's great. So, not quite sure what that slide's doing in there. Just put it in there for the follow-up. So, what do I mean by free sugars? And again, this is one sort of really once you get to that 6 months and you're talking about weaning. It is a minefield. There's not a short answer to it. It's just a minefield. You know, we're talking about sucrose, fructose, maltose, lactose, corn syrup, cane sugar, honey and fruit juice concentrate. Now, the one that's probably worth highlighting at this point is the fruit juice concentrate. Because if you look at a bottle and it says no added sugar, turn it over, look at the label, and if it will say something fruit concentrate, what they've done is they've taken the fruit and they've literally taken all the water out of it, which is what makes fruit safe for teeth, because 90% of it is water. But what they've done is concentrated it, and fruit juice concentrate is considered, categorised by the World Health Organization as a free sugar. So it is not one for adding. Then, you know, you've got all the obvious ones like sweets, cakes, biscuits, sweetened cereals, all that stuff. And again, get into the habit of looking at nutrition labels and what is high sugar and what is low sugar. And you're not sure, and I could go into it all now, but we'll be here all night purely on that. But you know, it doesn't include the sugars that are found naturally in whole fresh fruit, whole fresh vegetables, and those that are naturally present in milk and milk products. Those are not free sugars. So I say it's a bit of a minefield, but part of the difficulty is that things change in and around 6 months, and this is why the whole grey area about, you know, how long you continue breastfeeding, how that gets clouded, because there's so many other things that can influence the risk of tooth decay, not just breastfeeding. So what I always say is, you know, what after 12 months? You know, we know that children who are breastfed for the first 12 months of life have a reduced risk of developing tooth decay. But what do you do? Do you continue or do you stop breastfeeding? Look at all the other things. Are you practicing good oral hygiene with your little ones? Are you brushing teeth every night and one other time every day? Are you using a good quality fluoride toothpaste? You know, what else is going on and going into the mouth? You know, are there free sugars going in? Are there medicines in there? You know, what other food and drink, what other ways could sugar be ending up in the mouth? And again, that's not maybe just you that is feeding your little one at that point. You may be expressing milk and leaving it with somebody else who's looking after your child. What are they giving them? You want to consider how long and how often sugar is in contact with the teeth. That's what is going to make the big difference. So as I say, make sure you're brushing before bed one other time. Smear fluoride toothpaste every surface, all teeth and the gum line. Get in the habit of reading food labels, and stick to plain water, milk, breast milk should be the only things that are drunk between meals, and don't add sugar to food. Just because it tastes very bland to you does not mean that your baby doesn't like it. As we get older, our taste buds change, but you know, we don't want to create children with a sweet tooth if we don't live to. But get into the habit of lifting the lip. This was an Australian initiative, I don't know how many years ago now, called Lift the Lip. And what they were trying to do was get people in communities to get into the habit of knowing what they were looking for in relation to their child's dental health or oral health. So what you want to look and see, have a look, are there any white lines developing around the gum line, little white flecks? Now you can get developmental anomalies. So in other words, you can get developmental defects, things that happen where the tooth hasn't properly formed. You maybe have been very poorly during the pregnancy, there might have been complications, premature birth, those things. But that said, you know, a developmental defect will not necessarily become a cavity. So you want to start, well, Are they brown? Are they yellow? On your fingernail along them, are there little ridges? That's starting to break down at that point. Spots that don't really brush off, they won't brush off. And then those margins, that just actually breaks down into cavities. And then what happens is this progresses around here and the whole thing just completely breaks off. With or without pain and infection, I have to hasten to add, because I have seen children with really severe decay but with no actual infection. So what you want to do is try and nip things in the bud. If you are seeing this sort of white spot what we call white spot lesions around those gum lines, have a look at the diet. Have a look at, are you still just breastfeeding? Or as well as breast milk, what else is going into your little one's mouth? And how long are each of those things? And start reading labels. I used to do the mug stand in the supermarket stand, reading all the labels of things, and fresh fruit and veg is great, but it's also expensive. And I have done various things over the years about, I think I did one at one stage when I was looking after one of my grandchildren, a fresh mango versus a mango chewy thing that was targeted at small children at the snack. And the difference, as I say, one was going to be really detrimental to his teeth. The fresh mango was going to be absolutely fine. So I say, it is not easy. It is all a bit of a minefield. If you're not sure, please come and ask us, because it's mums and parents who are trying to do all the right things that I really get upset for, because you think you are busting your gut, you're doing all these things, you don't want your children, particularly if you've had bad experiences dentally, you don't want them to have any negative impacts. You want them to look gorgeous, you want them to have a healthy smile for life. And so often I find it's just people don't know what they don't know, or they can see something happening and they don't know what they can do to avoid it progressing. And there's actually, everything, any health condition, any disease is always best caught early, because if it's caught early, you can repair early signs of tooth decay. I think that's really important. If you've got those white spot lesions, you can remineralise those if caught early. And don't forget about your own oral health. I think that's really, really important. Trying to get time to brush your teeth, never mind cleaning between your teeth, can be a real challenge as a new parent, and particularly if you've got one that doesn't sleep very well. Look after yourself. I mean, we all feel better when we wash our hair and brush our teeth, and being a mum, that's part of that territory. So this is the breastfeeding and tooth decay, the core messages that they give for dental teams and healthcare professionals. And this is what your dental team should be aware of. You may find they are or they're not. And depending on where they've trained to, that can also influence that. So, you want to think about, what's going into the mouth, when it's going into the mouth, how long it's going to be in there. Breast milk is always best. We know children who are breastfed for the first 12 months have less signs of tooth decay. But there's so many other variables once you get past that point, and it all becomes quite grey and muddied after 12 months. So if you're not sure, lift the lip, look in your mouth, look in the mouth. These are some of the sort of common questions I get asked in relation to baby and small children's oral health. Should you use an electric toothbrush, use a manual toothbrush? It doesn't really matter. It's how you use it more than what you use, and I think that's really important. And that goes for yourself as well as your little one. If it's an electric toothbrush, you park the power on the tooth where the tooth and the gum meet, and let the movement do the work of the bristles. If you've got a manual toothbrush, you've got to make those bristles move. Again, round the gum margin, every surface, the outside, inside biting surface, along the gum line, every surface of all your teeth. Child doesn't like mint toothpaste. There are plenty of alternatives that still have the recommended level of fluoride in them, but are either totally mint free, so they're totally unflavoured. So we have an autism friendly toothpaste, what we'll call Oraners, which is absolutely ideal if you have got a child that doesn't like foaming, who's sensory issues. We've got a number of things that will help there. You can use your family toothpaste, that is absolutely fine. The important thing is when that first tooth erupts at about 6 months, you just want to use a grain of rice. It literally is a smear. You know, it's like a whistle of toothpaste, so your toothpaste will go a long way. My baby falls asleep at the breast. When should I brush teeth? You don't wake them. You want to brush your teeth as close to them going to bed as is possible. You don't really wake a sleeping child to brush their teeth, okay? But that is where you're working towards it. The last thing that touches their teeth is the right toothpaste. I know some breastfeeding mums who actually, when they're finished, because baby does fall asleep at the breast, they literally just put a tiny wee smear of toothpaste and just smear it over their teeth and leave them at that point. Should I floss my children's teeth? I'll put my teeth in. Floss my children's teeth. Should you floss your children's teeth? When do you start flossing your children's teeth? I love this question. Because in theory, as soon as teeth are in contact with each other, so you've got tooth there and tooth there, your toothbrush is not going to get that surface where the two teeth are in contact. Now, I have 6, 7 and 8 year olds using a product called gum chucks to floss. Are they wonderfully efficient at it? No. But do they see that as part of their oral hygiene routine? Absolutely. I have parents that floss their kids' teeth, again, gum chucks because it's really easy. Curepox and TP do a really fine interdental brush that many kids can use quite effectively. But again, you're best to talk about that with your dental team or talk to me about it, and I'll see what is going to be most suitable for you in your circumstances. So just to summarise, baby teeth really do matter, and I think there's nothing that is more fulfilling than having a child that gets to adulthood without a cavity, without any signs of decay, with healthy gums, healthy smile, do not know any sort of negative experience within a dentalist chair. And if they get into their teens and they need orthodontic treatment, your orthodontist is actually going to love them because they're going to be set up with a really healthy, solid foundation for looking after that mouth as they get older. Bottom line is breastfed babies that are breastfed for the first 12 months have less incidence, less experience of tooth decay. We know that, that's a fact. After 12 months, it becomes a bit grey. And the reason why it becomes a bit grey is partly because of quality and the way the research is done, but also because there's so many other variables which are independent to each family and each child. So once you get that first tooth arriving, you know, water, breast milk, if you can't breastfeed, infant formula, plain milk, those are the basics. Think and reduce how much and how often sugar is in the mouth. And I often find if parents eat it and it's in the house, the kids will ultimately want a spoonful or a mouthful of what mummy and daddy are having, or mummy and mummy or daddy and daddy. So really important that if you're looking after yourself and you've got a healthy diet, you seem to be drinking water, the kids will want it the same. And we know, you know, we transfer bacteria from our mouths to our kids, and those Streptococcus mutans. So if one of the questions I ask parents, if their child, when I'm doing a risk assessment of how high likelihood their child is to have tooth decay, is I'll ask, have either the parents had a cavity in the previous 2 years, because that means those Streptococcus mutants are active in the parents' mouth. And we kiss and cuddle our kids, we wouldn't have it any other way, but we then transfer them to the children. That's why the xylitol wipes are really good, because that reduces that load. And if you're pregnant, using a xylitol chewing gum or xylitol sweets, things like that, will also reduce your incidence of those particular bacteria which we transfer. That's another reason why you don't share spoons, particularly with girls and things like that, you know, because what is their oral health experience been? So you want to reduce how much and how often sugar is in the mouth, and I say that's something you can look at.